What is the difference between Suboxone and Vivitrol? If you have opioid use disorder, or OUD, and are looking for options to help you recover, you may have heard of Suboxone and Vivitrol. Both these drugs are the leading medications used to treat opioid addiction via medication-assisted treatments, or MAT, and have helped countless people achieve sobriety. But what is the difference between these two recovery medications? This video will explore that question more in depth and help you understand which treatment may suit you. Let's get started. Suboxone is an FDA-approved prescription medication used to treat opioid addiction. It is a combination of buprenorphine and naloxone, two drugs that work together to reduce cravings and withdrawal symptoms. Buprenorphine is an opioid partial agonist which binds to the same receptors in the brain as opioids like heroin and oxycodone. However, because it is only a partial agonist, it produces much weaker effects than these other drugs. Naloxone, on the other hand, is an opioid antagonist. It binds to the same receptors in the brain as opioids, but instead of producing feelings of pleasure, it blocks them. A certified Suboxone doctor can only prescribe Suboxone. It is generally taken once a day as a tablet or a film strip that dissolves under the tongue. The dosage and frequency of Suboxone treatment vary depending on the individual's needs. Suboxone doctors usually start their patients on a lower dose and increase it gradually over time as needed. One thing to note about Suboxone is it's a Schedule III controlled substance, which means it has a potential for abuse and addiction due to its buprenorphine content. However, the naloxone in Suboxone helps reduce these risks. Vivitrol is a long-acting opioid antagonist that is used to treat opioid addiction and alcoholism. It is administered as an intramuscular injection, and its effects can last up to 28 days. Because of its main ingredient, naltrexone, an opioid antagonist, Vivitrol binds to opioid receptors in the brain, preventing the person from experiencing the euphoric effects of opioids. Vivitrol is only effective in treating opioid addiction if the person has already completed an opioid detox program of at least 7 to 10 days. That is because Vivitrol only works if there are no opioids in the person's system. Otherwise, the person will experience severe withdrawal symptoms. Like Suboxone, Vivitrol is also used in comprehensive treatment programs to help people recover from opioid addiction in the long term. As we can see, there are major differences between Suboxone and Vivitrol. Let's recap a few. Suboxone is a medication that contains both an opioid partial agonist, buprenorphine, and an opioid antagonist, naloxone. It can both relieve withdrawal symptoms and prevent the person from getting high. Vivitrol, on the other hand, only contains an opioid antagonist, naltrexone. It means it can prevent the person from getting high if they use opioids, but it will not relieve withdrawal symptoms. Another difference between Suboxone and Vivitrol is how they are administered. Suboxone is a medication taken orally, by mouth, while Vivitrol is a long-acting injection administered once a month. Suboxone only treats opioid addiction, while Vivitrol can be used to treat alcohol addiction as well. Now that we've gone over some of the key differences between Suboxone and Vivitrol, let's answer some common questions about these two medications. A recent study published in The Lancet has shown that both Suboxone and Vivitrol are similar in effectiveness and safety. However, some addiction specialists thought otherwise because the same study concluded that patients have difficulty initiating and maintaining treatment with Vivitrol than with Suboxone. Because of that, some addiction specialists believe that Suboxone might be a better option for certain patients. Some addiction specialists think that Vivitrol might be a better option for certain patients, especially if they're also addicted to alcohol. Vivitrol is FDA approved to treat alcohol addiction as well. They have a hard time sticking to a daily pill regimen. They're no longer experiencing opioid withdrawal symptoms. They're treated in a controlled environment, such as an inpatient rehab facility. They have a strong support system in place. They're finished tapering off Suboxone. Vivitrol adds an extra layer of protection against relapse after Suboxone treatment is completed. Suboxone activates the mu opioid receptors, while Vivitrol blocks the mu opioid receptors. It means that patients will feel the effects of opioids in Suboxone, while they will not feel the effects of opioids in Vivitrol. As mentioned earlier, Suboxone and Vivitrol are equally safe and effective. Regarding side effects, both Suboxone and Vivitrol can cause nausea, vomiting, headache, and dizziness. However, the side effects of both these drugs are not severe and usually go away within a few days. The short answer is no. Suboxone and Vivitrol work in opposite ways. Suboxone activates the mu-opioid receptors, while Vivitrol blocks the mu-opioid receptors. If you take both drugs simultaneously, they will cancel each other out, and you will not feel any positive effects. Instead, you will feel severe withdrawal symptoms. Switching from Vivitrol to Suboxone is a decision you should make with a certified Suboxone doctor. They can tell you if Suboxone is the right treatment for you and will help you through the process of tapering off Vivitrol and starting Suboxone. As we conclude, we hope this video has helped clear up some of the confusion surrounding Suboxone and Vivitrol. While both drugs effectively treat opioid addiction, some key differences may affect which is right for you. If you or a loved one is struggling with opioid addiction, we urge you to contact a licensed Suboxone doctor. They will be able to help you figure out which treatment option is best for you and guide you through the process of recovery. Visit SuboxoneDoctor.com today to find a Suboxone doctor near you.